start out with a little experiment, and I'd like everybody to close their eyes for a minute. Everybody, waiters, waitresses, all eyes closed. I see some open still. Now what I'm going to do is give you a few sounds, and I want you to try to just memorize the sound. You don't have to try to guess what it is. Just memorize the sound. So here's sound A. Sound A. Now keep your eyes closed. Now we're going on to sound B. Okay, you can open your eyes now. This evening, I'd like to talk about something that's dear to my heart and close to my bladder. You all know what I'm talking about. Why, I'm talking about my prostate gland. That's right, the normal prostate gland is about the size of a walnut. Mine, however, is the size of a grapefruit. Now what does that mean? It means I make sound B instead of sound A. And I make sound B a lot more often than I make sound A. Now, an enlarged prostate is not a serious problem, and obviously from the TV commercials you realize that it's very curable. There is another problem, however, that's more serious than making sound B, and that's prostate cancer. More than 2 million American men have it right now. If you're over the age of 50, you have about a 1 in 14 chance of getting prostate cancer. If you have a relative with prostate cancer, your chances are twice as likely as somebody else of getting the disease. Most men don't experience any symptoms, and for some, they find out about it too late. There is good news, however, because there are a variety of successful treatments. Hormone therapy, for example, which stops the production of testosterone, either by using drugs or removal of the testicles. I'm sure the line's not too long for that one. Active surveillance, radiation, chemotherapy, and removal of the prostate gland itself are all proven remedies for this disease. There is also other good news. Prostate cancer is easily detectable. Like any other cancer, if it's detected early, it has a high success rate of curability. However, there are about 10% of the men that have it will die from it, mainly because it wasn't detected soon enough. The screening for prostate cancer takes the form of 2 tests. First, the PSA test, or prostate-specific antigen test, which is a simple blood test where they withdraw a little blood from your arm, send it to the lab, and if it comes back with a high PSA level, there's a good chance you could have prostate cancer. The second one is the one that men fear the most. It's much more dramatic, and that's called the DRE, or Digital Rectal Exam. That's right, the doctor must boldly go where no other man has gone before him. Now, men are always reluctant to go to the doctor, but that's not why they're reluctant to get the DRE. The real reason is they watch too many prison movies. Like anything else, the first time is always the worst. I remember my first prostate exam, and it probably went something like this. The doctor usually puts the glove on and gives it a good snap. And he probably said, "Ken, this is a mature decision you're making today. It shows a sign of a lot of responsibility. This exam will only take a few seconds, and it'll be modestly uncomfortable." Now, that's probably what he said, but this is what I saw and heard. Blah, blah, blah. Blah, blah, blah. Blah, blah, blah. Blah, 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 blah. Because I started getting my prostate gland in my early 20s, this summer marked my 28th anniversary of getting my prostate examined. If I can do it, anybody can. If you or your spouse are over the age of 50, I encourage you to have it done, or tell them to have it done. The potential outcome is much too serious to let pride get in the way. And remember, it's okay if the doctor puts one hand on your shoulder while doing the DRE, while you have nothing to fear, except Mr. Toastmaster.